Hi, my name is Dr. Michelle Hudspeth. I'm Division Chief for Pediatric Hematology and Oncology, and I'm Director of the Pediatric Blood and Marrow Transplant Program here at MUSC. My primary area of focus is blood and marrow transplantation for children, children with cancer and also non-malignant diseases such as sickle cell disease or immunodeficiencies. Primarily my focus is clinical research and clinical care. We are the only pediatric blood and marrow transplant center in South Carolina, and we transplant 25 to 30 patients per year, which places us in the top third of pediatric programs in the country in terms of volume. Our outcomes at day 100 survival and our 1-year survival are at or above the national benchmark, so we're very proud of what we've been able to accomplish here for South Carolina. One area of focus is looking at immune reconstitution after bone marrow transplant. So on average, it takes a patient 6 months to 1 year to have a normal immune system again after transplant. And so our kids require actually that they be revaccinated after transplant. They have to start that process all over again. And we've done several areas of research into looking at the best timing for vaccination after transplant. And recently I was an invited speaker at the American Society of Pediatric Hematology Oncology and the Pediatric Blood and Marrow Transplant Consortium combined session to talk about this nationally in terms of the way to approach the best way to vaccinate children after transplant. The most important thing I would like people to know is that our program here is committed to delivering the very best possible care for our children. And so our unofficial slogan is, make it happen. In general, I don't want to hear why something can't be done. Give us the worst of odds, and our goal is to turn that around. Large analyses have shown that socioeconomic status actually is the biggest determinant of survival after transplant. And when you look at the children in South Carolina based on zip code and income, we are taking care of children who are in the lowest quartile. So you would predict that our survival should be the lowest, but we've actually been able to have outcomes that are as good or better than the national standards despite having all these adverse factors. Our very strong belief is that if a child needs a transplant for the best chance of survival, our goal is to make that happen, whether or not whatever resources the family has or whatever significant issues that they're going with, we're going to make it happen for that child. The primary focus is making sure that the patients are well taken care of, and the research we fit in late nights and weekends. Our goal every day is to defy the odds. We are typically dealing with children in the worst of worst situations who often may be facing insurmountable obstacles. And our job every day is to get past that and make the impossible possible. And there's nothing more gratifying than seeing kids walk through the door who never should have made it. And so that's really why our team is here. And that's what we focus on.